Good afternoon. My name is Dakota Nichols, and today I'm going to be talking with you about shared decision making. The presence of diabetes continues to increase every year. Research suggests that by 2040, there will be 642 million cases worldwide. Type 2 diabetes can lead to blindness, kidney failure, heart attacks, strokes, and death. The American Diabetes Association has established health guidelines aimed at improving the quality of life for patients who have diabetes. However, patient adherence to the guidelines is less than favorable. It is estimated that 80% of patients with diabetes do not meet all of their intended health goals. During the process of this project, a PICO question was developed. In patients with type 2 diabetes mellitus, what methods of patient engagement and self-management lead to improved health outcomes? In this instance, improved health outcomes would be evidenced by improved HbA1c levels, improved blood pressure readings, and improvement in total cholesterol levels. The literature search and summary, there were multiple databases used to gather all the research for this project. The Cochrane Library, PubMed, CINAHL were the main ones that were utilized. In total, 10 articles were chosen for this project development. Of the 10 articles, 2 of the articles included a meta-analysis with a systematic review. 3 of them were just systematic reviews without a meta-analysis. 4 articles were randomized controlled trials, and the other article was a cohort study. The research showed that increasing patient engagement could lead to improved health outcomes. Shared decision-making was one method discovered that can improve patient outcomes by increasing patient engagement. Patients who participated in SDM were more likely to meet all established healthcare goals, and patients also reported a higher understanding of their health status after using shared decision-making. Now, the initial PICO question addresses all methods that can improve patient engagement. There were others in the paper that were addressed, such as telemedicine and interventions aimed at increasing the likelihood that patients attend their follow-up visits. However, for this project, I'm focusing specifically on the shared decision-making process. My grade A recommendation that involved the shared decision-making is providers should incorporate shared goal setting and decision-making when establishing treatment guidelines for patients living with type 2 diabetes. And that's supported by 2 level 1 articles and a level 2 article. My results from my setting assessment. The practice I chose approximately sees 150 patients a week. The provider I spoke with didn't know specific numbers, didn't have them readily available, but said he estimated approximately 80% of those individuals have diabetes and have it managed at his facility. He did say that approximately 70% of the patients that receive treatment there show improvements in their HbA1c levels within the first 6 months of beginning treatment. Now, the quality of that improvement takes into consideration where the patient is starting at. It would be unrealistic for the provider to expect someone with an initial HbA1c of 14 to drop it down to like under 7 in the first 6 months. With 70% of the patients make making improvements in their HbA1c levels, that means that 30% of the patients are not seeing any form of improvement after the first 6 months of treatment. The provider estimated that 90% of those patients, 90% of the 30% do not see improvements due to compliance issues. They're just non-compliant. So when you do all the math and take the percentages, that leads to approximately 22 patients every week are not complying with their diabetes treatment. The provider and I discussed that understanding what causes the non-compliance comes from a communication between the provider and the patient. A big step in improving the compliance is understanding why the patient is not compliant. What is causing the patient to be non-compliant? There was a willingness to implement a low-cost intervention at the facility that would focus on improving patient compliance. The setting and participants. The setting was a primary care / specialty care facility. They have quite a few options at that location. The specific person I was with was a primary care provider who treats patients of all ages. The participants for this intervention would be the project developer, myself, the provider, his mid-levels, the nurses that work with him, and the patient care technicians. And most importantly, you're going to include the patients as well. The implementation steps that will need to be completed. Initially, you're going to have the education period where the shared decision-making process and methods of implementation will be presented to the provider and supporting staff. You're going to educate them on the best ways to do it, what shared decision-making is, and answer any kind of questions they have at that point in time. The provider will determine which patients will be willing to participate just by asking. Once the provider is made aware of what the SDM process is, he can kind of explain it briefly to the patient and see which patients would be willing to participate versus which ones are not going to be interested. Once the provider has the list of patients he intends on including in the study, the provider will then develop an aggressive and a less aggressive treatment option for each patient. Part of the shared decision-making process is allowing the patient to choose between more than just one option of healthcare choices. The final stage is just the shared decision-making process will be implemented during the patient's next office visit. Some tools that were developed for the implementation process. This first one over here on the left is just a walkthrough example of what a office visit might look like where shared decision-making was implemented. Start with the patient. Patient walks in, goes through the registration process, takes approximately 5 minutes. Then the patient has vital signs and fills out any questionnaires that the facility has with the assistance of the medical assistant. Then the patient's put in a room and waits for the provider to see them. The provider comes in, completes the history, the physical exam, discusses with the patient what goals the patient has in relation to their health, what they would like to see outcomes be. And then the provider initiates the shared decision-making by using the tool over here. You see on the right is another tool that was developed just to kind of lay it out to where the patient can kind of see we have treatment A, we have treatment B. A is not going to be as aggressive. B is definitely a more aggressive approach. And then down below, what are the goals for each of the treatment options? What's going to be required of the patient to where the patient is fully aware of what they're committing to. And then just the pros and cons of each option to where the patient can make an informed decision. Once the patient has chosen the decision and the provider has communicated all those steps with the patient, Um, the nurse will come in, review the decision aid with the patient again, just a little reiteration, help answer any additional questions the patient might have, and also just very important to establish a follow-up visit that will allow the patient to come back in and be assessed on whether or not they're improving. The evaluation period, short-term evaluation, you're looking at about a month out. This process is really just going to focus on how well the intervention was implemented. It can be assessed just by having a staff meeting where you just have an open discussion with all parties involved, where they can discuss any problems, concerns, or suggestions regarding the shared decision-making process. Long-term evaluation, you're looking at 6 months, 12 months, and then 24 months. Patient wellness values, your HbA1c levels, total cholesterol, and blood pressure readings will be compared in the electronic health record from pre-intervention phase to your intra-intervention phase and your post-intervention phase. You want to see a trend. You want to see a downward trend in HbA1c levels. And this is just a stakeholder evaluation form that was developed. Do you believe this project could be successfully implemented in your practice? Yes or no? Before this presentation, did you have any prior knowledge about the shared decision-making process? Do you believe that adequate research was performed in development of this process? And would you be interested in sharing the project with fellow colleagues at other practices? Any questions, comments, or concerns would be addressed at this time. And there's the list of all the references that were included in the entire project. And that concludes my stakeholder presentation.